A Science 2020 article presented the case for sleep problems as the final common pathway for developing dementia due to inadequate clearance of neurotoxins, toxins in the brain, produced during wake time.
Some of you are saying, Parm, you are a physician. What are you looking for in terms of some of those things that can be disrupting our sleep? Either reducing the quantity or the quality, making it more difficult. And don't memorize this, but get a flavor, get a feel. This is kind of what goes through my mind as I'm sitting having a conversation with a person. Is that person able to breathe well? PNEA means air, A means without. This is a full collapse, but there's its cousin that's related to it called partial collapsing. So a full or partial collapse of the airway for 10 seconds. As you can imagine, choking would put a lot of stress on the body, a lot of stress on the heart, a lot of stress on the brain. Now, this one is a bugaboo, snoring. In a perfect world, which we'll work on eventually, but the opportunity is about basically half to 2/3 of people who snore don't breathe well at night. Remember our old CPR classes? We called it the ABC. If you don't have an airway, you don't breathe well, and then you don't circulate well. We got to go back to the original ABCs. So a big part of why sleep health and heart health are connected, it started with the sleep apnea conversation. Now, I'm going to take a little bit of dig at myself because I'm in the sleep medicine world in addition to doing internal medicine, executive health, integrative medicine, all these other kind of opportunities to help people. But what we do know is a lot of people associate sleep medicine with sleep apnea only. Because you go to a sleep professional, they give you a sleep test, they tell you if apnea or no, and you get a machine. Done. Or a pill in between. And I'm going to be honest, those sometimes are necessary, but there's so much more to sleep than whether you have apnea or not apnea. And also, please note, before you want to hang up this conversation at all, is not everybody needs a machine in order to treat their apnea. So we're going to be careful not to make this all about one topic. But do know with you not breathing well, that's one of the major challenges of getting to sleep, staying asleep, waking up feeling refreshed.